Lucia Mirales. Traditionally, I'm a pediatrician, but now I do a lot of integrative medicine and regenerative medicine. I did my undergraduate at UC Berkeley and my medical school at Stanford University. I initially went into pediatrics, did pediatrics for 15 years in private practice. Took 2 years off and then studied all the integrative regenerative stuff afterwards. And together with my husband, we created a practice and fused several styles of practice together, and now I practice mostly regenerative and integrative wellness. So we've used stem cells in different therapies, different conditions, and we did a joint, like an ankle joint for a patient who had multiple surgeries, a lot of scar tissue, and it went very well. He was able to have a reduction in his pain. He was walking on it and felt really, really good within a short amount of time. We have done it for a patient that suffered with migraines, and so we did a neuro protocol for him. We've also done it for a lady that had COPD and was on oxygen all the time, so she did the nebulizer procedure. We've done different protocols. We've also done just IV stem cells as well. So I've used exosomes and different products with extracellular nutrients, and then now we're using more of the stem cell products themselves. The efficacy is a lot more. For example, with the stem cells, you can use them IV, you can use them intranasal or the Mirales protocol for the neurologic. And you can also do the same with the exosomes, but you're probably not going to get as much for the cost of the product.